Hi, this is Kirk, the Bariatric Carnivore. I'm going to take a bit of a departure on my discussion when it comes to how psychopathic the system is and how broken it is and how they work in such a way that they, with absolute callous disregard for your well-being. And we're going to talk about COVID for a few minutes, not so much to rub people's faces in it, but instead to use it as an example of just how broken the system is and how dangerous it is to your health. I watched an interview on the Dr. Drew show last night with Tom Renz. Tom is an attorney who represented many of the families that were trying to get their loved ones ivermectin or hydroxychloroquine or monoclonal antibodies while they're in the hospital. And the hospitals kept telling the families no, they weren't going to allow approved drugs that were shown to be safe to be given to dying patients. And these are people that had all been told by their doctors, you're going to be dead in a couple of days. And they wanted to try maybe possibly effective therapeutics that could save their lives. And the hospitals callously said no. And the question is, why did they do that and what gave them the right? And frankly, I don't think they had the right, but they went ahead and did it anyway, with complete callous disregard for the well-being of the patients. Now you got to remember, who are the people that are the administrators that were saying no? Was it doctors? No. Most of the administrators in hospitals today are not doctors. They frankly, unfortunately, are MBAs. People have not taken an oath to preserve your health. These are people that are working for the bottom line of their hospitals. Well, why would they care? Because there was a bunch of money on the line. The federal government said, hey, if you follow our guidelines, we are going to give you X number of dollars per patient that may have COVID. And we're going to give you a bunch more money if somebody dies with COVID, or you think they might have COVID. They may be dying of cancer, they may be dying of a heart attack, they may have died of a gunshot wound. But if there's a possibility they have COVID, then it's a COVID death. You check that box on the certificate, the hospital gets X number of dollars. And you may think that's a grotesque system, but that's what it was. And I'm not trying to say that that's good, bad. I wouldn't support it for the life of me, but it is what it is. That's what was happening. And I'm not trying to correct it, change it, whatever. I'm not trying to say that everybody that was involved in it was bad. I'm just saying that's what it was. And the reason why I'm pointing it out is you don't have a choice. If you're stuck in there, you are caught in that system. So what's the best way to avoid it? Don't get in the system. See, when you look at the people that got COVID, they were unhealthy. I mean, what was the number one thing that was going to get you in trouble? Being old with comorbidities. All those comorbidities boiled down to metabolic syndrome. They were people who were fat, high triglycerides, low HDL, high blood pressure, low vitamin D, all these things, and high blood glucose levels. Vitamin D is really a marker of overall metabolic health. I mean, you can stay in the sun and you can take all the vitamin D supplements you want, but it's difficult to have a healthy amount of vitamin D in your system unless you're metabolically healthy. That's just a reality. So all these people that were just the most vulnerable were the ones that ended up in the hospital because they had underlying health conditions. And that's, once they got into the hospital, they were alone, without advocates and without therapeutic treatments. And this is what really gets grotesque when you really look at what happened during COVID. There was a concerted effort. The hospital administration became part of Big Pharma's overall chain. They had, in order to profit from COVID, they needed to get an emergency use authorization for the COVID vaccine. The only way they could get an emergency use authorization for the COVID vaccine was to make sure there were no therapeutic treatments available. So they were working hard to make sure that no one did a study on ivermectin, hydroxychloroquine, monoclonal antibodies, steroids, all the standard treatments that we've been knew worked. They would not allow them to be used in those hospitals, because if they were, then a case could be made. There was no reason for an emergency use authorization because we had treatments available. There were billions of dollars on the line, and they held them accountable, and they used your tax dollars to bribe hospital officials, hospital administrators, to tote that line. That's what happened. Upton Sinclair said, "It is difficult to get a man to understand something when his salary depends on him not understanding it." And that has never been more true now. When you listen to public health officials go over and do postmortems on our response to COVID, time and time again you say, well, we didn't know about it. Yeah, they did. Everybody that didn't have their head in the government's wallet knew exactly how to take care of their health. Heck, back in February of 2020, as soon as I started hearing about this COVID thing and how it was starting to spread and how it could kill 5% of our population, I got on the internet, started looking around going, what do I have to do in order to keep me from being part of that 95%? I listened to all sorts of lectures on how to make yourself healthy, how to have an improved immune system. That's what got me to go completely carnivore. That's when I started exercising at home. That's when I started really working on my sleep. I mean, I worked hard for a couple of months to make myself as difficult as a target as possible. I was out walking in the sun every single day trying to increase my vitamin D level, because I noticed over in Italy, all the people that were dying of COVID had ridiculously low levels of vitamin D. I wanted mine to be as high as possible so I wouldn't want to be one of those people in the hospital. And I wasn't alone. There were a bunch of people that kind of figured it out, but a lot of it was suppressed by the big media, working hand in hand with big pharma, all the people in big government, the hospital administrations, and even the corporate doctors. They all got wrapped up into it. Who lost? You, your loved ones. People had to die in the hospital alone because they're following federal guidelines and they wouldn't allow family members in to see dying people. And that was grotesque. Absolutely heartless, but they were willing to do it. And if you listen to that interview of Tom Renz, there's even worse things. There's a very good possibility that they were deliberately killing people in the hospitals with morphine drips. That's bad. That's how bad it was. That's how bad the system is. You can't trust your health to it. Your only solution is get out. Make yourself so healthy you don't have to be part of it. Thankfully, they're really darn good. The healthcare system and hospitals are really darn good at fixing you up when you've got an acute problem. If you've been in an auto wreck, frankly, there's no place I would rather be. But there's not a lot of money in car wrecks. There's not a lot of money in acute illnesses. There is a lot of money, though, in treatments for long-term illnesses that could be easily cured with lifestyle. But they don't want to talk about that. And as a result, they don't understand lifestyle because that's not where their salary depends on. Their salary depends on them not understanding it. It's a hard lesson. I hope more people understand it. Not everybody is. Not everybody is going to get themselves healthy. Not everybody is going to want to get themselves out of the system. A lot of people are going to want to sit around, watch CNN, get all excited about the latest, greatest thing, and completely ignore their health. I hope you're not one of them. Hopefully we can reach thousands of people through this channel and help them to realize, I don't have to be a statistic. I don't have to be part of the system. I can get myself out of it and actually come out financially ahead. That's what this channel is about, is getting yourself healthy and out of the system so you don't have to be part of it anymore. And you don't. And if you want to be part of this community, please hit the like, subscribe button. The bigger this community gets, the more people we have talking about this, the healthier more people are going to get, and we'll be able to spread this message to more people. This is Kirk, the Bariatric Carnivore. I'll talk to you tomorrow.